Welcome to this research proposal on public stigma towards male breast cancer patients and whether there are any gender differences within this. Breast cancer is a disease in which the cells in the breast grow in an abnormal and uncontrolled way, and with less than 1% of all breast cancers occurring in males, it is reported to be on the rise despite being considered rare. However, due to the universal rarity of breast cancer in males and high occurrence in females, it is often considered to be a woman's disease across multiple settings, with the majority of studies and support groups capturing the female experience of breast cancer, which in turn contributes to the stigma experienced by male breast cancer patients. Stigma is understood to involve a characteristic that makes a person different, whilst being devalued based on this difference, either by public or self-opinion. Jones and others identified peril, cause, origin, concealability, disruptiveness, and aesthetics as 6 components of health-related stigma, which vary by illness. Cancer patients can experience stigmatization as a common reality, as the disease can create negative feelings such as fear and insecurity within others, and can cause far-reaching implications for cancer patients, such as fear of assessment, diagnosis, treatment, or other help-seeking behaviours, a decrease in mental and physical well-being and self-esteem, and therefore necessitates research. Meeting and others conducted a mixed method study in a German population, investigating how male breast cancer patients experience the stigma of suffering a woman's disease and what their perceived solutions were to reduce it. The study indicated that male breast cancer patients experience most stigma and feelings of exclusion, specifically in public as opposed to private settings. However, it did not explore this further in terms of gender. Another survey study conducted on a cancer stigma in a sample of English non-cancer adults used a cancer stigma scale and found that while stigma was generally lower across the sample, overall stigma was higher towards men with breast cancer and was associated negatively with cancer screening. As evidence above, the current literature review indicates a paucity in studies focusing exclusively on the stigmatisation of males with breast cancer through the lens of the public in Australia. There is a gap in knowledge surrounding points of view and related stigma of both males and females who do not have cancer towards males that do in an Australian population. The aim of the current study is to gain a greater understanding of public stigma towards male breast cancer patients and to ascertain whether there are any differences in stigma depending on gender. The study will aim to answer the following questions. What stigmatising attitudes do the general public express towards men with breast cancer? And are there differences between males and females in the stigmatising attitudes they express towards men with breast cancer? The proposed research question will be answered using an exploratory method, whereby participants will be interviewed on stigma towards male breast cancer patients in one-on-one, semi-structured video or phone interviews. Thematic analysis will be used to analyse the interview transcripts to assess for any differences in stigma towards males with breast cancer between male and female participants. A qualitative research methodology has been selected over a quantitative method for the current study, allowing for an exploratory and discovery-oriented research that aims to study people's thoughts, feelings, and experiences using open-ended questions and responses and language as the raw data. Given there is no current interview guide specific to this area of research, the interview guide utilised will be developed from the literature review. The tool will be analysed and assessed in the ethics application phase of the research project. The student researcher will receive appropriate training on interviewing from the chief investigator. Participants will be recruited via an online platform with the incentive of a potential prize. Recruitment will ideally yield equal numbers of English-speaking females and males. As per the project sample size recommendations noted in Terry, Hayfield, Clark and Braun, the ideal number of participants recruited will range from 6 to 10. Participants under the age of 18 and those with any current or prior diagnoses of any type of cancer will be excluded, as this may contaminate the type of data the student researcher is looking for. The time for this research project spans over a 10-month period with 3 6-week teaching periods as shown below. Whilst the method compilation and data collection are not scheduled until teaching period 3, the interview guide is projected to be ready for use in week 1 of teaching period 3 to allow for supervisory consultation and accommodate any potential recruitment delays impacting the overall schedule. A solid draft of the method is aimed to be completed prior to the conclusion of teaching period 1. Data collection is aimed to be completed within the first 3 to 4 weeks of the allotted 6-week period, allowing ample time for transcription. Preliminary data analysis is planned to commence between teaching period 3 and the start of teaching period 5 to allow enough time for this process. Some potential limitations for this project include the below. The student researcher aims to overcome these anticipated limitations through regular consultation and training with the chief investigator throughout the entire project. In relation to ethics, the student researcher acknowledges the sensitivity of the research question and therefore plans to place the following steps and safeguards in place to ensure participant well-being. Prior to recruitment, providing participants with an explanatory statement advising the details of the study, including what will happen to their data, and therefore obtain informed consent. De-identifying and keeping participants' information confidential, regularly reiterating with participants the right to withdraw consent and participation from the study, and providing appropriate support services to all participants. Results are proposed to be disseminated via research summary documents and flyers to the below offices. The significance of this study lies in its potential to increase awareness among support groups, cancer foundations, and the government on how to best market this illness and fill gaps in knowledge by providing Australia-specific data, given the current identified paucity in this area. Practitioner knowledge and the policies and procedures in working with male breast cancer patients and their families in both psychological and medical fields can be sufficiently improved from the findings of this study. Finally, this research will provide the foundation for future more targeted research in this area. And by simply conducting this research, it may even contribute to reducing cancer stigma towards male breast cancer patients. Thank you.